So hello, as we know that the cervical spine of all trauma victims should be considered as unstable and it requires to be protected by application of a cervical collar early in their management while assessing and managing the airway. So every healthcare professional should be aware as to how to select an appropriate size collar and how to apply it. In the market, various types of cervical collars they are available. The one comes in a prefixed size and they come in various sizes like small, medium, and there's a large one also. So they have got two components. One is the anterior component and the other one is the posterior component. How to identify these two things is that the anterior one, it has a hole in the center through which one can manage the airway. The upper part of it is shaped in the form of a mandible, and then we can see that there is a chin rest over here, and this part, which is a broader one, it goes towards the shoulder. Similarly, in the posterior component of it, the thing which is narrow, it comes in the occiput of the patient, while the broad one goes on the base. And in fact, it is mentioned here, this is the back component and this side it is up. So it is all mentioned in the collar. Now the one which comes as an adjustable collar, they come in two varieties. One is for a pediatric and it's all written here, that's mini one. And the other one is an adult one, which is again mentioned here, it's for an adult. Now how to select an appropriate size cervical collar? What we have to do is, we have to gauge the distance between the patient's lower jaw and the upper part of shoulder. And we can gauge it by using our fingers. And if I measure the distance between the patient's lower jaw and the upper part of shoulder, then this side should match the side part of this cervical collar. Now in the prefixed one, we can determine the size. Now the measurement remains same. So we have to gauge the distance between the patient's lower jaw and the upper part of shoulder by using the fingers. And then that should match the side part of it. Now if suppose we require a larger part of it, then there are two locks in it. We have to pull these locks apart. There are two keys which needs to be pushed backwards, and then it is adjusted depending on the length of the neck. It is adjusted, and suppose it fits in here. Now these keys they go in and it is then locked. Now this collar, it can be used. So now subsequently we'll demonstrate as to how to apply these cervical collars, the one which comes with the prefix size and the adjustable ones. So now I'll demonstrate how to apply the cervical collar, and for helping me in this demonstration, we have Dr. Surya and Dr. Ankit with me. So now what I will do is, I will just measure the distance between the lower jaw of the patient and the upper part of shoulder, and then this is nearly, you see here, it's like 5 fingers. So I will select a cervical collar in which the height of the collar is nearly, it's 5 fingers like this. So this will be an appropriate size collar for this patient. Now what we do here is, once the patient is on the couch, Dr. Ankit, can you just please hold and maintain the inline spine immobilization here like this. We take the posterior component of it, the posterior part of it, and then we fold the strap over this. And then we flatten it as much as possible and pass this. Now this part remains up, this part remains down. We fold it back and then we pass it beneath the neck of the patient like this. Like this. You have to just hold it here, Dr. Ankit. And once this is in place, I will take the anterior component of it. I will fix it through the upper part here, and then we'll fix it by the Velcro tapes on either side. Now you can leave and the spine is immobilized. Now I'll demonstrate how to use this adjustable cervical collar. The size determination remains same, and we know that this patient fits in a cervical collar which is like nearly 5 finger breadth here. When this collar, it comes in the default setting of small size. What we have to do here is, we have to open the locks, we have to push back the keys here, and we have to adjust the height of the cervical collar by pulling these flaps apart. So this should be nearly 5 fingers here. Now once this is in 5 fingers, I'll push these keys back and will lock it like this. So once we have adjusted the height of the cervical collar, this chin component of it, it needs to be flipped before use like this. Now this component goes in back. So just hold the spine, and then this part, it goes back. Once it goes back here, this part is rotated in front of the patient, so that the chin, it rests over this piece, and this Velcro tape comes in its place, and the spine is immobilized. So as application of cervical collar is an important clinical skill, so every healthcare worker should be aware of how to measure this right size for this of the cervical collar and how to apply in our patients. So I thank Dr. Ankit and Dr. Surya for helping me in this demonstration. Thank you.
Thank you, sir.